All right, let's talk about something that can be, a little jarring to see, but is so important to understand: hematuria. We're going to treat it like the check engine light for your body's plumbing, and our goal today is to figure out exactly what that light is trying to tell you. Let's get right into it.
So let's just cut to the chase. You look down, and something is, well, it's not right. What does it actually mean to see blood in your urine? It's a totally fair question, and yeah, it can be a shock, but understanding it is the absolute first step to figuring out what's really going on.
Medically, there's a name for this: hematuria. And the definition is actually super simple. It just means there are red blood cells in the urine, where, they really shouldn't be. That's it. It's not a disease itself. Think of it more like a signal, a symptom that something else needs a closer look.
But here's the thing, not all hematuria looks the same. In fact, sometimes you can't see it at all. And that brings us to the two main ways we classify it: the stuff you can see and the stuff you can't.
Okay, so the first type is what doctors call visible, or gross hematuria. This is exactly what it sounds like. You can actually see it with your own eyes. Your urine might look pink or red or even kind of brownish. Then on the flip side, you've got non-visible or microscopic hematuria. For this one, the red blood cells are so few and far between that they can only be found with a lab test or under a microscope. So you're probably wondering, if you can't see it, how do you find it? Well, it's usually picked up with a really simple dipstick test at a doctor's office. But, and this is a big but, these tests are super sensitive, so they can sometimes give you a false positive. Things like really intense exercise, being dehydrated, or even just some contamination can trigger it. That's why follow-up is always, always key.
All right, so we've got a handle on what it is and the different types, but what's actually causing it? In this next part, we're going to run through some of the most common culprits, from the really simple stuff to the more complex.
Now, the list of potential causes is, well, it's long. But the good news is that a lot of them are incredibly common and totally treatable. We're talking about things like your garden variety urinary tract infection, a UTI, or kidney stones, and for men, an enlarged prostate, which you'll hear called BPH. So even though seeing blood is scary, a lot of the time it points to one of these pretty familiar issues. And here's a perfect example of why even that microscopic hematuria is so important to check out. Get this. You can have massive kidney stones, I mean huge ones, and they can be completely asymptomatic. You feel absolutely nothing. The only clue, the only sign that something is wrong might be that non-visible hematuria that gets picked up on a routine test. Crazy, right? And the list doesn't stop with just UTIs. More serious infections, like a kidney infection known as acute pyelonephritis, can cause it. And in different parts of the world, you even see it with conditions like genitourinary tuberculosis or certain parasitic infections. It just goes to show you how hematuria is this really general signal for inflammation anywhere in the urinary system. Okay, let's shift gears for a minute. We've talked about infections and stones, which are common, but now we need to talk about the more serious side of things. Because sometimes hematuria is a critical warning sign that you just cannot afford to ignore.
When there's been an accident or some kind of physical injury, this is one of the first things doctors look for. Why? Because hematuria is considered the cardinal marker of trauma to the urinary tract. If someone's been in a car crash or had a bad fall and there's blood in the urine, that's an immediate red flag that there could be an internal injury.
Now, here's something that's really counterintuitive, but absolutely crucial to know. You'd think more blood means a worse injury, right? Well, not necessarily. The amount of blood does not always line up with how severe the injury is. In some really rare cases, you could have a major, life-threatening injury to a kidney and see very little, or sometimes even no visible blood at all. And of course, we have to talk about cancer. Hematuria is a key symptom for a few different cancers in the urinary system. For bladder cancer, for instance, the classic description is that it's painless and intermittent, meaning it comes and goes. It's also a common sign for kidney cancer. That specific pattern, painless and on and off, is a huge clue for doctors to investigate further.
So after all of that, from a simple UTI to a serious injury, what is the one essential thing you need to take away from this?
If you remember only one single thing from our entire conversation today, let it be this: hematuria is a symptom. It is not a diagnosis.
It really truly is the check engine light for your body. When that light comes on in your car, it doesn't tell you exactly what's wrong, does it? It just says, hey, something under the hood needs attention. Hematuria does the exact same thing. It signals that something needs to be checked out by a professional.
So, let's end with this thought. Your body is trying to send you a message. Whether that sign is big and obvious or totally invisible, whether it's painless or not, the core message is always the same. Pay attention. The real question isn't if you should listen, but how quickly you're going to act on what your body is trying to tell you.